Well, I went to medical school at UAB, and I did a radiology elective in my senior year of medical school. And part of that was a week elective in radiation oncology, and I was very impressed with the way they were able to care for patients and avoid surgery and how well the patients tolerated it. I went into internal medicine after medical school, and after a year of that I decided to go back and finish my radiation training. So that's what I did, and I've been happy with that ever since. When we started the Van Scott Cancer Center here in Birmingham at the Urology Centers in 2007, we really wanted state-of-the-art, top-of-the-line, standard community radiation oncology for prostate cancer, and I think we've accomplished that beautifully. We have a fantastic staff, everywhere from the front desk people all the way back to the therapists and nurses, physicists. The whole support staff are top-notch, and they're dedicated to prostate cancer treatment. And we do things like, we do intensity modulated radiation therapy, image-guided radiation. We're able, we have top-of-the-line Varian linear accelerator. When somebody comes into the center here as a new patient for a consult, I try to spend quite a bit of time. I usually devote an hour to that first discussion, and I'll go through the entire process of their diagnosis and what their PSA is and the grade of their cancer, and try to make sure that they understand everything that I know about them. And I go through that and I write it all out for them. So when they leave here, usually they have a pretty improved perception of their situation, even if they've had several discussions before they've been here with other doctors, which most of them have. Usually they have a little better idea, and I try to make our discussion on their level. I want to answer whatever questions they have. I always like it when they come in with a list of questions and we go through one by one, so when they're finished, they're satisfied that their questions have been answered, and we make a plan for treatment. Sometimes that plan is to go to surgery. Sometimes the plan is to have a seed implant or external radiation. Sometimes the best treatment is to go somewhere else and have treatment closer to home. But we discuss all those options, and when they leave here, we have a game plan and we go through there. Sometimes people need to think about it a while, and I'm not going to pressure them. I say, come back in a month or call me in next week after you've discussed it with your family or your family doc, and here's the options. Here's what I think maybe the best 2 or 3 options. There may be several things that they have to discuss, but that's kind of how I approach it. It's more I consider my job largely to be educating the patient on what their situation is and what their options for treatment are. So, we do certain techniques to try to avoid radiation dose to the bladder and rectum, and when somebody comes in, I go over all that in a lot of detail and spend a lot of time with the patients. And it's interesting, a lot of the patients, it's a several month course of treatment in many cases, and a lot of patients at the end of the treatment, you'd think, oh, they're miserable, they're going through all these treatments, but many of them say, oh, I'm so sorry that I'm finishing because I'll miss everybody, and it's such a warm, caring atmosphere. When I'm not practicing medicine, I'm married. I have 4 children. They're all getting up in age. I have 3 out of college and 1 still in college. But they're all still in the area, and we spend a lot of time together as a family. I've got 1 child that's married, and we have a place a little bit out of town and have some woods and some property and some horses, and I work on a couple old cars, and got a lot of outside activities that I like to spend my time with.